Morning, guys. Welcome to Patient Pick Me Up. Headed to my first patient of the day, and I gave this patient some education last week on how important it was just to get up and get going every morning. They're not a particularly strong patient, and I was explaining the importance and the benefits of home exercise program 3 times a day. And to get to 3 times, you really need to get that first one in early, right before or right after breakfast. And it made a lot of sense to them, and so we're trying it this week. First thing in the morning. It's just a couple minutes after 8 o'clock now. And even though you might not be a morning person, when you're going through a period of prolonged weakness or you've just had an injury, it's really important to get back to where you were as quick as possible and putting forth that extra consistent effort to get back to your old normal. And the home exercise program is a wonderful tool to do that when you can't just do your normal activity. So I always tell everybody, before and after breakfast, either one. If you like to work out before you eat, it's not a big deal for you, or right after you eat, then right at 12 o'clock before or after lunch. And then you can take a big long break, 7, 8 o'clock, right before bed, whenever your bedtime is. And that's an easy way to get your 3 in without it feeling like it's sucking up your whole life, because by noon you've got 2/3 of it done, and you can do whatever you want or whatever you need to do for the 7, 8, 9, 10 hours, and then do the last one right before you go to bed. That way, I found, is the best way to build the habit of doing it consistently, and also it doesn't feel like it's always hanging over your head, because the first 30 minutes that you've opened your eyes, you already got 1/3 of it done. As far as for therapy goes, 1/3 of your day is done by 8:15. But just some food for thought, something to chew on this morning. Oh, goodness gracious. So those are things that work for that I've seen work very well for patients. And there again, people that consistently do the home exercise program are always the ones that have great outcomes, or at least it gives you the best opportunity to have a great outcome. Obviously, there's lots that go into having an injury to, hey, I got a great outcome and I'm just as good as I was. You have a surgeon, and you need to have effective wound care and infection control concerns that need to be dealt with along the way, and you have to have a good therapist, which there's lots of good therapists. Find one that you trust, find one that listens and is willing to teach. A therapist should always be willing to teach. When you ask why, a therapist should rattle off a reason that you're satisfied with. And if you don't understand, they need to be able to repackage that information in a different form and ship it right back out to you. When you just say, I don't quite understand that, can you give it to me again? You need to be a educated patient on your injury, on your illness, on your disease, because no one cares about it as much as you do. And you need to be educated enough to know that if a healthcare professional is less than educated on that particular injury or procedure, and that's the one you got done, and you ask them a question and they give you something that doesn't quite jive with what you need to, at least be educated enough in your own issues that that, well, this particular professional may be great at something else, but this may not be their forte. And there's a million things in the healthcare world that, you know, patients, therapists, doctors have to look up every day, because you know, the second I meet the person who knows everything about everything, I'll just drop over dead, because you don't. And if you do, they're probably lying, because nobody knows about it, because it changes every day. You can, you know, be on the cutting edge, you know, get a different job for 24 months. You don't have any idea what the new stuff is. Everything changes really quick. So, moral of the story today, you know, we always say consistent effort when we talk about setting personal bests, but boils down to consistency over intensity. The home exercise program is a wonderful, wonderful tool to keep that consistent effort. Continue to put in that input that your body and your muscles and your nerves and your brain is going, all right, got to get back, got to get back, got to get back. And 3 times a day is plenty. It's good. And so there you go, guys. All right, go get them.